In terms of skin-related procedures that you can provide in the clinic, what specific procedures do you do, and how complicated are they?
Great question. Broad range of things we do here in the clinic. We try to do general medical skin issues, whether lipoma, sebaceous cyst. We'll do sutures as well in there. We'll definitely look at biopsies for, early dermatologic sort of abnormalities that we can't quite make heads or tails of and send them off for pathology. I can remove those fairly easy. We have a good procedure room to do that. We also will do some aesthetic work, and this can be a variety of different things. Again, laser hair removal, skin tightening, just skin smoothing. So we tend to work on creating a little less of a rough appearance, less aging type appearance. My philosophy regarding many of those issues are overall conservative. I tend to not be an aggressive treater. I think sometimes the issue of seeing a person having rapidly changed their appearance based on this is not as attractive as something that could be a slow and fine progressive change in doing so, which is why we'll use things like our Icon laser or radiofrequency device to just help improve the appearance of someone in the long term. We'll do Botox injections in areas. And again, we tend to be a low Botox volume individual. We disagree with the use of large volumes of Botox, sort of consistent with our overall conservative approach.
In terms of the procedures you were talking about, the mole removals, the cysts, are those procedures that have a lot of downtime? Are they things that need to be booked in advance? Do you need to lay eyes on them before you're able to remove them?
We like to know in advance what we are going to remove. I think there is a strategy associated and a preparation time that is required for doing so. How much time? Maybe very little time if it's a very small little mole that just have some subtle abnormalities that make it worthy of doing a biopsy on, versus a large sebaceous cyst or a lipoma that will require, a significant time to remove, maybe even up to an hour in order to get this all done, because we want to end up with a good aesthetic/cosmetic type appearance when we are all completed.
Are these procedures, whether that's from the cyst removal, mole removal side or the laser side of things, are these things that you can do on just your patients, or do you take patients that are not yours?
I will accept referrals from patients. I think it's important to make sure that you share that skill set with those people who do need to have it. It is within limitations, and we have to kind of look at it and have a discussion. There's always a consult kind of needed with that, and we don't just blindly accept any and every referral we get. We definitely look at them and screen them and kind of say, yes, I think this is something we manage here in the clinic, or we cannot, and we would recommend looking alternatively to other resources.
And the final and most important question that everyone always asks, what's the cost associated with it? Is it covered by healthcare? Is it private?
That's a great question. Some of the bumps is often covered by public health care. Some of the more aesthetic things are not covered by health care. And again, that would probably be a discussion that can be had at the time of the consult, because you never know what is or isn't covered at this point.